I'm Dr. Wes Mullins, and I'm here with Dr. Van Dyken, and I'm so glad you got the opportunity to take our courses because you've had an opportunity to take some other implant courses, and restorative-driven implant therapy is kind of like the way that we like to teach this, as you've seen. What about this course, though, stands out for you compared to some of the other courses that you've seen?
There's a few things that stand out. The first thing is how heavily supported by evidence everything that you teach is. That's really important. I know that I'm being taught the latest of what the research is telling me that is appropriate care for patients. Another big thing that I've noticed here is that the ability to work on local patients, my own patients, being able to...
So patients in America,
patients in America,
right.
But also a patient of my own that I bring to the class that I can follow up with.
Right.
It's a great thing to go overseas and to put a lot of implants in, but oftentimes the patient selection is not the best. They are not cases that I would try to do.
Right, so the follow-up with a patient that maybe you select or maybe we're following together, you feel that that's a value because you get to see the healing, you get to see if, like, hey, they really aren't in pain after the procedure, or there is something going on and you can follow up with support. And how much does support mean to you?
Support is really important. As a new dentist, a fairly new dentist to implant placement, it doesn't really matter when everything goes right.
Right.
It's those cases where something doesn't just...
It's going to happen. I mean, you're going to have things that go wrong. So mentorship and a follow-up with the course instructor or an implant mentor for you is paramount.
Absolutely. Especially as I'm early in my career, to know how to handle cases when things don't go right is really important.
Being able to pick up the phone, call Wes, call one of the support agents and say, hey man, can you look at this? Can you go over this with me? I mean, you can't beat that.
Right. Or even a case that you just finished and you're thinking, well, could this have been better? To say, hey, look at this case. What do you think? What can I learn from this and do better than that?
Well, thank you so much for spending time with us over the weekends, and I appreciate you, and congratulations.
It's been a blast. Yeah, I enjoyed it. Thank you.